It is estimated that up to 4% of females will struggle with bulimia at some point in their life. And concerningly, only about 6% of that group will ever seek treatment. So the role of an outpatient therapist is so significant in eating disorder recovery. Probably because they're often one of the first lines of defense. Someone who's struggling with bulimia will consider going to a counselor and forging a relationship there and coming to terms with their disorder and learning skills and techniques to develop a life free of bulimia, which takes a tremendous amount of work. And a therapist is such an ideal colleague, coach, friend to get you through the months and sometimes years it takes to fully recover from bulimia. But also, when an individual is needing more intensive treatment and going into intensive therapy through an IOP or a partial hospitalization program or even residential, significant work can be done there. But afterward, they're definitely going to need to work with a therapist in an aftercare program and continue to work on the areas that they addressed in treatment. So the therapist plays a crucial role at many levels of recovery. And even when an individual has gone years in recovery, it can be so helpful to continue to touch base with the therapist that you worked with and continue to grow in the areas that you're striving to heal. The best thing about working with a therapist is you can get this unconditional positive regard and this opportunity to have someone fully listen to you and mirror back to you what you're saying, what you're thinking, what you're feeling, and allow you to grow in ways that we rarely get in this life. So it's very important to choose a good fit, and this blog will cover some points and tips for choosing a good therapist. The main thing I wanted to stress today, though, is find that person, and even if it takes a few interviews before you settle on the right therapist, know it is so worth it to get that coach and helper in your journey to recovery from bulimia.